I think this is a very important point, and there is a bit of conflicting evidence on this as well, in that some studies suggest that people with higher sleep disturbances benefit more because they have more to gain from them. And other evidence suggests that this should be used for people with milder sleep difficulties. I think healthcare leaders and healthcare providers should still recommend evidence-based treatment for individuals with clinical insomnia. Cognitive behavioral therapy for insomnia, for example, it's quite effective. For individuals with subclinical insomnia or that have occasional sleep disturbance, the healthcare provider again should reflect with the person on the possible causes and the nature of their sleep disturbance. Because we know that sleep is impacted by everything. So it might be psychological, but it might be a behavioral or societal influence to your sleep disturbance. And it is very unlikely that this kind of intervention might help every single case. So I think, yeah, just understanding the root cause, and if the root cause is possibly a target for this type of intervention, will be good. I know a lot of people might be worried about the impact of screen and blue light at bedtime, but there's kind of mixed evidence about that, and most phones nowadays have filters for it. So I think what I would be more worried about is that the same device you're using to play the Sonic sleep aid is a device where you can access your work email, message your friends, or access social media, or an endless stimulation. And so I think both clinicians and especially users should be kind of honest with themselves and try to think, okay, will I resist the urge or the temptation of checking my emails for one more time or checking social media? And like, yeah, just be honest with themselves about this. We also know that discipline is a finite resource and that it kind of gets depleted as the day goes on. So that's something to consider as well, that probably just before going to bed, we are tired. We've been working all day. So maybe we are at our most vulnerable in terms of like resisting temptations. Um, but that being said, there's a lot of different things that you can do on your phone, from do not disturb to have like timer for the apps and stuff like that, to external physical device that you need to scan to unblock the apps. There are a lot of things that can be done in that regards. And something that we suggested in our review as well is that this is a speculation, but it might be that this type of content works as a harm minimization strategy, and that there's a lot of people that would be on their phone anyway, and that this is the least harmful content to consume just before bed because it is kind of designed to make you relax. And so for people that would use their phones anyway, this is somewhat the least terrible thing that they can do at bedtime. Um, but yeah, I think all these things should be considered on a case by case study, especially for for adults. I guess for children and adolescents will be a completely different story.